Good evening. My name is Dr. Parth Goyal, and I'm accompanied by my wife, Dr. Priyal Goyal. We are both psychiatrists and we practice at Parth Hospital in Ahmedabad. Today, we would like to discuss some of the most frequently asked questions, myths, aspects of psychiatric illnesses which are commonly misunderstood. So, in this Q&A session, I will be asking the questions, and Dr. Priyal will be answering those questions based on our experiences and what the reality regarding those questions are. So, Dr. Priyal, the first question that is most commonly asked is, are psychiatric illnesses really illnesses, or are they weakness in character, or are they happening because of lack of motivation?
To answer this better, let me just tell you how we diagnose a mental illness. So, a mental illness is not diagnosed if someone is sad or if someone is upset. That does not equal to being depressed. You could be sad for some time, be upset for some time, and yet within some time you might become normal. If the sadness continues for a longer duration, if you're not able to perform your routine activities, you're not able to indulge in activities that were previously pleasurable to you, then probably you are depressed. However, diagnosing a mental illness is not as simple as this. There are a lot of criteria, there are a lot of symptoms that we see, and after that, we diagnose a mental illness. Once the illness is diagnosed, after that, we decide whether it requires treatment or not. So,
So, in your clinical experience, what happens, or how often do you have patients or caregivers coming in and saying, "अच्छा, I don't think he's motivated, I don't think he's positive, बहुत ज़्यादा encouragement हमने दिया, लेकिन फिर भी ये ठीक नहीं हो रहा." So, what is your response to that?
So, lack of motivation, lack of being positive, they are not the only criteria for saying that a person is depressed. There are a lot of other things that we look for in a person before diagnosing him as depressed. Lack of motivation or not being positive could also be a part of his personality. They could also be because of situations around him. There are a lot of times when people are out of their comfort zones, and that is why they are not able to do what they are supposed to do. Second, most important thing is people feel that counseling is equal to giving advice, which is not true. A layman giving advice is not equal to a professional giving counseling. So I think that needs to be differentiated from हमने बहुत मोटिवेट करने की कोशिश करी पर वो नहीं हो रहा है.
Thank you so much. Moving on to the next question. Do all psychiatric illnesses require medicines, or can they be treated without medicines?
So this is a very common question which is asked by most people who come to me, to us, and their choice would be to not take medicines and get better by just talk therapy, which is known as nowadays, and counseling. However, the first line of treatment in psychiatric illnesses is always medicines. Yes, it is your choice whether you want to take them or not, but it is our duty to tell you that you require medicines and that is how you will feel better. If we feel that you do not require medicines, we won't prescribe them. But that is in a very rare case where it's maybe just a little anxiety or a little depression, which can be cured by just counseling. It routinely does not happen.
So, to answer that in a different way, just like any other physical illness, psychiatric illnesses are also categorized based on severity. So, you have mild illness, moderate illness, and severe illness. Being sad is not equivalent to being depressed. If you are given a clinical diagnosis of depression, then it is usually categorized into mild, moderate, and severe, and treatment is usually dictated based on that severity. A transient phase of sadness or a transient phase of anxiety without any major impact on your life might respond to motivation enhancement or to some sort of talk therapy. But once you have been diagnosed with a proper psychiatric illness, medication become the first line. The role of medicines would be to enable you to be in a state where you can receive and process psychotherapy in an efficient manner. So, one of the most commonly asked questions in the psychiatric practice of all psychiatrists, I think, is, I don't want to take medicines. Will counseling work in my case? Or rather, I really want to take counseling. I don't want to take medicines. How will counseling help me? Dr. Priyal.
This is a recent fact that has come up, and it has been actually shown in a lot of movies also, where sitting on a couch and talking to a therapist solves all your problems. There is a huge difference between taking advice from someone and taking counseling. So, let me start with whether counseling will work for you or not. Counseling works in very mild cases of depression or anxieties or situation related issues wherein resolving the situation might help you get out of the problem. Counseling is not equal to giving advice, which is what people believe nowadays. Counseling is a very defined process wherein the process starts with insight orientation, where we tell you about yourselves, we help you understand yourself, we help you understand what you're feeling. The next step would be how to change yourself. Counseling is not about suggestions, it is not about giving you a direct advice. So, no one can come to me and say, please counsel me on whether I should continue dating this boy or should I break up. I cannot tell you whether you should continue dating or you should break up, but I can tell you how to take a decision. Counseling is not just one way, there are different types of counseling. The type of counseling is also decided based on the type of problem that you're facing, and usually it takes not less than at least 4 to 6 sessions for you to actually come out of whatever you're going through. And hence this new recent trend that has come up, that I'm going to see a therapist, I'm going for counseling, that is very different from taking advice or actually taking treatment for a psychiatric illness. A psychiatric illness cannot be treated with just counseling, and in almost all cases, I think if not all, in most cases, counseling is an addition to treatment. It is not a substitute for the treatment. Also, I would say that if you are going to a doctor for their opinion, do not go with a notion, a preconceived notion that I do not want to take any other form of treatment but just counseling. You're going to a doctor, take their opinion, let them decide for you what works best for you. If counseling is going to work for you, they will suggest that. But if it is not going to work, take their opinion. That would be better than deciding for yourself whether you want just counseling or not.
Thank you so much. So let us try to understand this better with an example. So, Dr. Priyal, a patient comes to you, the young boy who's been in a relationship for a few years. They've recently broken up. He's extremely sad. He's crying. He's not feeling good about himself. He's not feeling good about everything that is happening around him. How will you approach the case? How will you decide whether counseling is what is required in this case or it is medicine that are required in this case?
So, first of all, I will have to go through the symptoms that he is facing. Symptoms, like I said before, that if I want to diagnose him, I will have to go through a certain criteria, whether he is actually depressed or he is just sad about his relationship probably breaking. If he is just sad, then yes, counseling will work in his case. But if he is showing signs of clinical depression, then I will not say that only counseling will work in your case. A lot of times, patients are suicidal because of relationships, and there are parents who feel that it is not a big deal. I mean, he's just saying that, but he will not do it. You cannot say that for sure. We have had patients who've actually made attempts of killing themselves because they were in a long term relationship, they broke up, and they couldn't cope with it. So, this will depend on the extent of the illness, on the severity of the illness, and not just this much that because it was a relationship and he's going to break up, so it is a situation based thing and it can be cured just by counseling.
Another frequently asked question to us is that I do yoga, I work out, I do pranayam, I eat the right food, and I still feel depressed. Why is it not working? Or I have depression. Will doing yoga, pranayam, eating the right food, working out help me become better? What is your take on this?
So, this is a very frequently asked question and it is a very difficult answer. So, let me get a little technical in this one. Whenever there is a mental illness or a psychiatric illness, It is caused by certain neurochemical changes in your brain, wherein there are neurotransmitter involved. Neurotransmitter, and the reason we give treatment is to bring these neurotransmitters into balance. So, yoga, pranayam, intake of good food, working out, all of these are lifestyle changes and they help you lead a better life. They cannot work as a treatment for mental illnesses. Of course, they help you improve your lifestyle and automatically they make you feel better. But if you feel that you were depressed and yoga, pranayam, or working out or eating better made you feel better, then somewhere your diagnosis might not have been depression, it might have been something else, and that could be reconsidered.
Another thing that we see very often during our treatment is that people want to consider doing yoga or pranayam or working out as the primary line of treatment. Let me compare it with diabetes. In patients with diabetes who have high blood sugar levels, cutting down on carbohydrates or not eating sugar is not going to bring their diabetes into control. Usually, the first line of treatment with diabetes patients is always medicines which are either given orally or in the form of an injection, that is an insulin. Once the diabetes has come into control, lifestyle changes like healthy eating and exercise are recommended so that the diabetes stays in control. Similarly, yoga, pranayam, working out are modalities which can help you control your depression once it has been treated. They cannot be used as the primary forms of treatment in patients who have mild, moderate, or severe depression.